So, hi guys, this is the Loud Voice podcast, and I'm your host, Tatina Wasal. And as we all know, this is a climate change, climate action, climate justice space that brings in young people to get to know information about what climate change is and what they're really supposed to be acting on. You can't act on what you don't know, and this is where you get to know what you need to act on. Okay, that is it. So today I have with me a guest, and the guest is Bhavik Barochia.
Yeah.
Okay, Bhavik, please welcome to the Loud Voice podcast.
Hi everyone.
All right. So Bhavik is a scientist.
I am a scientist. I'm actually now a consultant.
Oh, nice. Fancy ones.
Yeah.
And you're also an advocate for water for human beings, animals, and everything.
Absolutely, using water for health, using it for health applications.
All right. I feel like that introduction is not enough. Please, your names, how you pronounce it, and everything.
Absolutely. So, Hi everyone, my name is Bhavik Barochia. I am a consultant at the global consultancy Arab. My interests are very much around using wastewater for health. So I'm very much interested in taking wastewater from different sources and monitoring it for different health markers. So markers of human health, animal health, and environmental health, which you may have heard of, described previously as One Health, which recognizes that interconnected nature.
Okay.
My background is actually in microbiology and infectious diseases, and I very much enjoyed studying this, did my PhD in kind of respiratory infections.
Okay.
And now I have translated those skills and that knowledge into using wastewater, and the techniques that we learned in those medical fields, we now apply for environmental monitoring, and that's very much a kind of growing area of interest globally.
Okay. Why wastewater in human beings and all that?
Absolutely. So wastewater is a kind of an incredibly valuable source of information. Often we think of waste as exactly that, waste, something that we don't want to be associated with, something we want to discard.
Yeah.
But wastewater is an indicator of human health in many different formats and ways. So it gives us the capacity to monitor how people behave, how we can specifically design infrastructure around our humankind. Everyone goes to the toilet, it's a fact.
Yeah.
And because everyone does, it's an unbiased source. A really good example is if you wanted to find out about somebody's health, the current way is usually asking them, sending them a survey, or trying to engage with them in an interview. This doesn't always work, and you don't always get the correct answers. No one can lie in their sewage.
Oh yeah.
And this is a very valuable tool.
All right. So you take these waste, take them to the lab since you're a scientist.
Absolutely. So we take the waste, we sample it, and usually we we don't do it in a way that identifies anybody. So we do it in a place where lots of people's waste ends up. This could be a wastewater treatment plant. This could be a septic tank in an apartment block, or it could be a wetland in a rural community. We then take that, we pull that sample, and we then analyze it for these different markers. And when we then look back at how that correlates to the population, how that kind of maps to the different numbers, we can look at the levels of different markers within that population, whether it's infectious diseases, cholera, whether it's different infections of like COVID, but also things like diet, health, and different markers about drug use as well.
Okay. Now I'm trying to understand how you people do it. Like people are always sitting on the other end, waiting for us to go to you and then go pick it, so you can do your scientific work. And this is how you get to know that this area has cholera. And
Exactly. It's a fantastic way of mapping. So when we then take our digital skills, our knowledge of how to map it using computers, we can create maps, heat maps, which can give us indicators of how much of that disease is present in different populations. So really good examples is the spread of certain viruses like COVID. We can actually track the spread from one place to another and how it's infecting people through that passage by taking samples, lots of samples all the way around that country. So we ran this program in the UK and helped run it in Wales. It's something that's taking off in the US as well, and there's a lot of different countries now really turning towards this data because it's unbiased, because it's reliable, because it's whole population level. It gives us a really useful way of monitoring population health in a really effective way and very cheaply compared to monitoring individual people.
Exactly. I realize it's making work easier instead of everyone going to the hospital and everyone trying to be tested and everything. So what do you feel in your body? So you're using the expression that people actually don't need to get useful information that translates now to what our healthcare systems can do.
Exactly that. And it's fantastic because you don't have to go and sample people individually. You just take these samples, you run this analysis outside of people's times, and then you just report that information back to the people and also the scientists, the policymakers, and let them make really effective decisions using this data. Decisions that could be made could be things like policy changes around healthy eating habits, policy changes around different community behaviors. If there's high drug use in an area, you could target that by helping provide rehabilitation clinics to improve people's health in that area. And if you didn't know that information, you would be blind and you wouldn't know where to target your interventions.
That is very smart. That is smart. Okay. So in the end, I know you do your scientific work on everything, but where does this wastewater go to afterwards?
So we actually at the moment are storing some of this wastewater. So the idea being that we can use it for future studies. There are different ways and new markers that we can detect that emerge all the time. So if we can effectively create a biobank for these, then we have snapshots of human health at various time points through history. But for the samples we do discard, we just remove them and we make sure they're disposed of in a very environmentally friendly way. Often it's going back into the sewage systems in the UK, but if it was in another country, we would then adapt that by putting it in their relevant sewage disposal route.
Okay. I hope our local governments can actually adapt this, because this is a very good way of knowing how people are faring on in big masses without needing to use so much resources. So this podcast is about climate change. Okay, and I know climate change affects our health and everything. And I want you to tell me, or I want you to relate what it is you're doing to climate change, because I know we met at a climate change forum, an event, and you were here to speak about climate change, and just want to know how everything you're doing right now connects to that.
Absolutely.
And also health.
So I think what we have to recognize is climate change is changing the world around us. One of the key factors is climate change is resulting in increased global temperatures. Mosquitoes are being able to travel to new areas that aren't previously inhabited by them, that could potentially carry malaria, dengue. These diseases aren't always exposed to in other communities. A really good example is in the USA this year. We saw that the population in Florida had organic transmission of malaria, malaria transmitted by mosquitoes. And this wasn't something brought into the country, which meant that it was a situation that arose where people had never seen before. People hadn't had malaria in that region before. And this is because of climate change. And likewise, climate change is resulting in changes to sea levels. Sea levels are rising. And this is a real problem for coastal communities. The coastal communities will have challenges such as sanitation issues, where they will have more flooding. And flooding often results in things like cholera outbreaks. And so where we see this, waterborne diseases, absolutely. And so those waterborne diseases, we need to be able to monitor more effectively. So using these kinds of techniques, we can be tracking these diseases, tracking the spread of these diseases, both in emergency kind of disaster response, but also on a more routine level around the country.
Like I'm touched, starstruck. Like with everything I'm hearing right now, I'm like, where are we when all these things are being done? Like, why do we always resort to the traditional ways when there are smart ways? But what I know is most people like to use resources more than making it like bring the resources, number of resources you're using down here. I'm so happy about what people are doing. It's amazing. It's mind blowing.
Thank you.
when you started, I didn't even know how it translates to climate change.
No, absolutely. And a lot of people often miss the link. But actually, climate change has so many implications on health. And being able to monitor for it now is really critical. It's actually becoming more critical day by day. Because the better we are getting at monitoring for it, the better we can then implement strategies to help minimize the disruption to our normal day. COVID disrupted our whole lives.
Exactly.
And we don't want to repeat of that. So if we can make sure we get early detection, early intervention as soon as possible, using techniques like wastewater-based epidemiology, then we can really save lives.
All right. I want to throw something to you. I know it's not related to this as we finish this. When I started this, I posted my first video, and the first comment I got was from someone from here, and the comment was like, the comment went, climate change is not real. It's just a Western agenda meant to control us Africans and things like that. And I just want you to give me a comment, like make a comment about that.
Absolutely.
As a scientist who is working with real data on the ground and things like that.
Absolutely. So I think anyone to challenge whether climate change is real or not, I recommend they look out their window. Often, when we look out our window, we now see a world that is very different to what was 20 years ago. Just looking, and because we know where we recorded this podcast right now, we've got a beautiful view of Lake Victoria. We've got a beautiful view of Lake Victoria. But looking at Lake Victoria year on year, we're seeing changes. We're seeing changes in fish populations. We're seeing changes in flooding patterns. Lake Victoria, as because of sea level rises, is now seeing increased water levels. And this is problematic for those communities. I saw just the other day on the banks of Lake Victoria that where the water level now comes to. And a local told me that 10 years ago, it was never this high. This is really becoming real very quickly, and climate change is a good, we can see very clearly that climate change is becoming a problem faster than ever before. So anyone to challenge whether climate change is real or not, I think would be, I would ask them just to look out the window, look at the world around them, because you are seeing changes and none of them are good.
Yeah. You know, things are disastrous. Very many things are happening. I like that you like using, this is not for me to sound loud, so then we go on to sound them like crazy. But I feel like we've gotten to a point where whether we want to accept it or not, it's actually here.
Absolutely.
And one thing I know is I've lived in the lake, but I've never heard of fish dying in such big numbers. There gets to a point, you're lucky you came to Kisumu when that is not going on right now. There is a time around the year when it's so hot and the lake starts smelling.
Yes.
I don't know the science in that, but it gets so uncomfortable that I ask myself, what do people living around here? Because I live way up there and you can feel it.
Yes.
And that is still a result of climate change.
Absolutely.
Right?
As global temperatures rise, it's going to change the chemistry of the water. And as the chemistry of the water changes, this becomes less accommodating to the fish population. That fish population will die. And as a result, we see more and more of these phenomena happening. And this is not just on Lake Victoria, this is actually happening around the world.
Yeah. Right. I wish you had more time to talk about all this thing and that whole topic, the whole thing you're doing and how amazing it feels. And I wish, like I said, I wish our governments here can adapt into these means to get to know, because we tend to react other than like solve it before it comes. Rather than mitigate, it's called mitigation, right? Rather than mitigate. So we'd rather react later than actually do things to help solve it before it actually comes.
Absolutely.
And I'm hoping this is a call to action for us also, because this is nice, okay? I wish we had more time, but we don't, and I want to let you go back and mingle with everyone else and just network. So guys, that is all I had from the side, me and Bhavik Barochia.
Thank you very much.
Oh, I pronounced that correct, right?
Spot on. Absolutely.
All right, so that's what we had, and from us here, it's just a bye-bye.
Bye-bye.
Yeah.